Hi, I'm Dr. Vijay Sharma. Today I want to talk to you about Botox. I do a lot of that in my Coral Gables office. I'm a double board certified facial plastic surgeon. I'm here today to talk to you about Botox and answer any questions that you have. Botox is generally considered a very safe medication. Botox, as with any medical treatment, certainly has its risks. That's something to discuss with your provider before making the decision to have Botox. And overall, it's a very safe medication. The actual delivering of Botox, to give the medicine to the patient, roughly takes about 5 minutes. When you come in, we talk about your general medical conditions, what medications you take, and all those things, and make sure that it's safe for you to proceed with this particular treatment. This should be done with any kind of treatment or any kind of surgery, and have a good dialogue about what Botox is, how it works, and really go over all the information. To actually do the procedure, again, takes roughly 5 minutes. We find that people that come in for Botox are in the office for certainly less than an hour. Generally, the effect from Botox lasts for about 4 months. The first time you do it, it can be possibly 3.5 months. I do see that in some of my patients. Similarly, I see in my patients that have had it multiple times, they can sometimes get a little more than 4 months out of their Botox treatments. But an overall short answer is that Botox treatments last for about 4 months. Botox is delivered with one of the smallest needles that's made in the country today, but it's still a needle, so there are some pinches that go along with Botox. For patients that are particularly afraid of needles, what I do is I put a topical anesthetic on. I usually leave that anesthetic on for a ballpark of 30 to 45 minutes before doing the injections. That certainly helps a good bit. Usually from Botox, what I find is that patients have, you have a little bump that's essentially like a mosquito bite. It goes away by the time you get to your car, and definitely by the time you get to work. I do see an occasional little bruise if someone, especially if they're taking aspirin. There's no real protocol for anything that they have to do at home. You don't necessarily even have to ice. There's not much really to do after Botox. As long as the medication is placed in the appropriate place, there's really not that much to do afterwards. You begin to see the effects from Botox roughly 2 to 5 days after administration of the medication. There is a similar product, which I use a lot of in the office as well, called Dysport. That's D-Y-S-P-O-R-T. Dysport is another medication that's very similar to Botox. I do see a clinical effect in Dysport a little bit sooner than with Botox. Again, I see the effect from Botox, let's say ballpark of 3 to 5 days. With Dysport, I'm seeing changes within 1 to 2 days. So that's a little bit faster. And also, it generally lasts just about as long. So the question is what to watch out for if you're considering Botox injections. In general, I think the best way to avoid potential problems with having Botox injections is to go to someone that's a reputable doctor that has the appropriate credentials. A doctor can be board certified, but not necessarily in the appropriate subject matter. That's the best way to head off problems. I've heard of all different kinds of things happening with Botox. I've heard of counterfeit products. I've heard of infections. I've heard of systemic effects from Botox, which is generally very, very rare, and it's hard to say exactly what happened in those circumstances. So I think the best way to go is to really see somebody that's credentialed, that this is what they do. And it turns out this is what I do. I'm a double board certified facial plastic surgeon. I take a lot of pride in what I do, and you know what? I'm good at Botox. Botox is the first of a specific kind of medicine that's used to relax muscles in a very specific way. Botox has been out for a period of time longer than any other medication that does this. In this way, it was really a pioneer sort of procedure. There is a relatively new entrant onto the market that is used in Europe for long before it was used here, before it got FDA approval. That's known as Dysport, D-Y-S-P-O-R-T. It's a very similar medication, but they're not the same. The way that I describe it to patients typically is Coke and Pepsi. Coke and Pepsi, they're very, very similar. They taste similar, but you know what? They're a little bit more than one medication that relaxes these wrinkles. Botox is the common name that's used, and it's a medication that's used commonly. Again, Dysport is a new and relatively new entrant onto the market and works very, very well. There is a new medication coming in the new year that's going to be similar as well. I see patients that have had Botox and they had it in the past, maybe 5 years ago or 7 years ago, and they say, you know what, it didn't do much, I didn't like it. You know, what I say to them is, you really go to someone that does it a lot, and go to someone that does Botox a lot and thinks about it, and it's really something that they do and they take great pride in. Not somebody that's going to run you through the office and give you the cheapest price in town. Really go to someone that knows Botox, and then see if you like it. Give it a fair shake. Botox can definitely be a one-time treatment. You can do it once, the effect goes away in 4 months, and then you really don't have to think about it again. There's nothing lasting or permanent that occurs with Botox. It's something, again, that you can do once and not have to worry about again. What I do find is when Botox is done properly, people like it and they want to do it again.